Hello, my name is Angelina Savarese, and this is Module 2, Discussion Board, and I chose to do Activity 1, the paranasal sinuses. There are 4 paranasal sinuses. They include the frontal, which is labeled as 1 on the image to the right, the ethmoid, which is labeled as number 2, the sphenoid, which is labeled as number 3, and the maxillary, which is labeled as number 4. These sinuses are hollow portions of bone that surround the nasal cavity, and they function to amplify the sounds that we speak and to make the skull lighter. So our example patient, his name is Daniel. He got into a fight at a sporting event. He hurt his nose, so he went to the doctor. He got an x-ray. There were no signs of any fractures. And 10 days later, after his nose started to heal, he was having pain and discomfort in his nasal septum and his right maxillary region. So I believe that the probable cause of this pain and discomfort is that he has maxillary sinusitis, which is just the infection of the maxillary sinus. The maxillary sinus is labeled as number 4 in the image to the right. It is on either side laterally to the nasal cavity and is deep to the zygomatic and inferior to the orbits. To assess if he does have maxillary sinusitis, you would palpate the region, and I will demonstrate how it is done on myself. So you would take 2 fingers, the pointer finger and your middle finger, and you would find your zygomatic bone, which is right here, and then you'd go just underneath it and palpate the area, checking for swelling or tenderness. Step by step, I believe that after he got into the fight, he had an opened wound, and it was not cleaned immediately, so a bacteria, a virus, or a fungus got into his bloodstream and then reached the membrane of his right maxillary sinus, and then it became infected, which is how he ended up with the diagnosis of maxillary sinusitis. Thank you.